Assalamualaikum and hello guys, my name is Muhammad bin Roslan. I'm from RSR 2433C. Okay, so today me and my friend are going to present about special test for ankle injury. So I hope all of you can enjoy and watch our video. Assalamualaikum and hello guys, my name is Muhammad bin Roslan. Okay, so today I want to tell you one common ankle injury, which is peroneal tendonitis. Okay, the anatomy of peroneal tendonitis. Peroneal tendons are two tendons in the foot that run side by side behind the outer of the ankle bone. One peroneal tendon attached to the outer part of the midfoot, while the other runs under the foot and attached near the inside of the arch. The main function of the peroneal tendons is to stabilize the foot and ankle and protect them from sprains. Basic types of peroneal tendon injuries are tendinitis, acute and subluxation. Okay, tendinitis is an inflammation of one or both tendons caused by repetitive activity or overuse of the tendon. Acute tears are caused by the repetitive activity or trauma, while degenerative tears or tendinitis are usually due to overuse and may develop over a long period of time, or often years. In degenerative tears, the tendon is like taffy that has been overstretched until it becomes thin and eventually frays. When one or both tendons slips out of their normal position, the injury is called a subluxation. Peroneal tendon injuries occurs most commonly in individuals who participate in sports that involve repetitive or excessive ankle motion. And then the next is symptom for peroneal tendinitis. There are many symptoms such as the pain and swelling at the ankle, and then instability of the foot at the ankle, and then the increase in the height of the arch, and then a snapping feeling of the tendon around the ankle bone, and a sporadic pain behind the outside of the ankle bone. Firstly, feel the lateral tendons behind lateral malleolus. Then, ask the patient to actively dorsiflex and invert the foot. Repeat the step that I mentioned earlier. And then, positive test is indicated by the tendon subluxing without pain. And the last, ask the patient whether he feel pain at the area. Okay, and then for do's and don't. Okay, for do's, do ask the patient in which area he or she feel pain, and then the person should seek the doctor if the injury become worse. And then for don't, first, don't assume that you know what type of injury that the patient have. Ask first in which area that he or she feel pain, and then don't push the patient to do the movement for this test. It may lead the injury to become worse.
My name is Hafiz bin Hashim. Today I would like to talk about the Tala-Til test. What is the purpose of Tala-Til test? The purpose is to examine the ankle for injury of the anterior talofibular ligament, posterior talofibular ligament, calcaneofibular ligament, and deltoid ligament. The anatomy of injury are the injury happen when the ligament are torn or tear due to some factors such as excessive of force are placed at the ankle when landing on foot from high place without absorb the impact. The injury also might be associated with other injuries such as high ankle sprain, lateral malleolar fracture, lateral sprain, or high fibular fracture. The ankle sprain often have associated redness to due increased blood flow at the area. Then swelling also can be possible if the ligament are torn or tear. The test might be positive if the patient complain about the pain at the ankle while doing the test. And lastly, excessive capping than than usual at the ankle, also one of the positive to the injury. So let's see on how the procedure of talatil test are done. Talatil test. To test the anterior talofibular ligament, bring the patient foot into plantar flexion and then grab the calcaneus and perform inversion. Next, to test the calcaneofibular ligament, take the patient foot to the anatomical position and bring the foot into inversion and eversion. Alright, next, to test on posterior talofibular ligament, patient foot must into maximal dorsiflexion and perform the same movement again, that is the inversion. That's all for the talatil test. Thank you. Alright, next we continue with do and don'ts for the injury. Do and don't for injury are: don't put too much pressure while rotate the ankle due to the unknown injury. Besides that, focus on the patient reaction while doing the test. Then, make sure the ankle and foot are at relaxed position before start the test. Don't continue the test if the patient show reaction of positive due to the injury while perform the test. Lastly, ask the patient about the pain scale from 1 to 10 while doing the test. Alright, that's all from me for talatil test. Thank you.
Okay, hi. Assalamualaikum warahmatullahi wabarakatuh. My name is Imran Sopian from SR243TC, and today I want to talk about special test or skill test for the ankle injury. In this topic, I will tell you about the anatomy of the injuries, common injury at the joints, and then mechanism of injuries, also procedure of special test of this special test, and then do's and do and don'ts during the special test. Okay, let's go. Okay, firstly we go to the anatomy of the injuries. The injuries that I want to discuss is tarsal tunnel syndrome. Tarsal tunnel syndrome is a condition that caused by the repeated pressure that result in damage on the posterior tibial nerve. The tibial nerve branch of the sciatic nerve and is found to your ankle. Then we move to the second one, which is common injury of the joints. Okay, the inflammation from the arthritis, lesions and muscles like tumors or lipomas near to the tibial nerve. That are the injuries or trauma like an ankle sprain or fracture also. Any inflammations and swelling from which lead to the TTS, or we call it tarsal tunnel syndrome. Okay, and then we move to the mechanism of the injury. The tarsal tunnel syndrome is caused by anything that produce the compressions on the posterior tibial nerve, such as persons with flat feet is at risk for the developing tarsal tunnel syndromes, because the outward tilting of the heels that occurs with fallen arch can produce strains and compression on the ankle. And then the second one is systemic disease such as diabetes and arthritis can cause swelling, thus compressing the nerve. And then the third one is injury such as an ankle sprain may produce inflammations and swelling in or near the tunnel, resulting in compression of the nerve. Okay, next we move to the procedure of the special test.
To conduct the test, have your patient in supine lying positions. Then, maximally plantar flex your patient's ankle, bring the foot and the heel into maximal inversion and compress the posterior tibial nerve posterior to the medial malleolus with your fingers. This compression is applied for 30 seconds. The test is positive if the patients complain about numbness, paresthesia or pains in the toe ball of the foot.
And the last one, I want to tell you about the do and don'ts for special tests. And don't assume that you will know exactly what type of the injury that you have. Okay, and then the best patients are the most informed patients. That means that the more you know about your body and your specific injury, the better you will understand your treatment plan. And then a person should consult with a doctor anytime when the TTS or thalassemia syndrome symptoms occur. And then if caught early enough, a wide range of therapeutics, medications and corrective device is used to help treat most the TTS symptoms, and it will help you. Okay, that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Zikri bin Mahadzir. So I'm from RSR 2433C. So today I will do my second assignment for subject sport injury care and safety. So today we'll talk about a special test for the ankle injury. So first I will talk about the anatomy of the injury. So the injury occur when the foot turn in or out to an abnormal degree relative to the ankle. Ankle sprain are among the most common injuries to the lower extremity. These are a result of a fall or misstep during ambulation and sporting related episode. So this injury occur in the lateral ligaments on the outside of the ankle. Sprain can range from tiny tears in the fibers that make up the ligament to complete tears through the tissue. So lateral ligaments injuries are perhaps one of the most common sport-related injuries seen by physiotherapists. So lateral ligament ankle sprains are referred to as inversion ankle sprain or as supination ankle sprain. So the site of the injury for inversion ankle sprain are interior talofibular ligaments and calcaneal fibular ligament. So this injury is classically as an inversion injury at the ankle and subtalar joint of the foot, whereby several structures may be injured. So it includes the anterior talofibular ligament (ATFL), calcaneal fibular ligament (CFL), and posterior talofibular ligament (PTFL). So ATFL are the most commonly injured ligament, with inversions originates from the anterior aspect of the lateral malleolus and attached to the anterior medial aspect of the neck of the talus. So its function is to resist anterior translation and internal rotation of the talus on the tibia. So the anterior drawer test is useful for identifying an injury to this lateral collateral ligament. The patient is in sitting position with the knee in flex position to relax the calf muscle. One hand of the examiner stabilizes the distal tibia and fibula, while the other hand holds the calcaneus, maintaining the ankle in a natural position or 20 degrees of plantar flexion. A translatory force is applied on the calcaneus, pulling it anteriorly, while the tibia and fibula are pushed posteriorly. Lastly, I will talk about the do's and don'ts. So do's first, ask the patient if she or he feel the pain while perform the test. Second, if it was out of your control, tell the patient to go and see the doctor. So for don'ts, do not do further on the test when he or she already feel the pain. Don't assume that you know what the type of the injury if you are not professional enough in this field. So don't push the patient to do some movement if he or she already feel the pain and it may become the worst. So that's all from me. Thank you.
Hi, my name is Qistina. I would like to share with you guys about Achilles tendon special test, which is Thompson test. The Achilles tendon is the strongest and largest tendon in the body. It's the conjoined tendon of the gastrocnemius and the soleus muscles and may have a small contribution from the plantaris. The muscles and the Achilles tendon are in the posterior superficial compartment of the calf. It connects your calf muscles to your heel bone. The Achilles tendon spans two joints and connects to the calcaneus to the gastrocnemius and soleus muscles, comprising the largest and strongest muscles complex in the curve. The tendon is vulnerable to injury because of its limited blood supply, especially when subjected to strong force. First, indirect trauma from physical activities is related to overexertion and sudden force dorsiflexion during active plantar flexion. This injury often occurs during sport activities such as basketball or tennis and is felt by the athlete as a sudden sharp pain directly behind the ankle. Second, direct trauma or long-standing peritonitis, which means a condition characterized by inflammation of the sheath around the peritoneum, often found in association with degeneration of the tendon and/or the bone-tendon junction.
Video, I'm gonna show you the Klager's test to diagnose syndesmosis injury. The distal tibia fibula syndesmosis between the fibula and tibia is formed by major ligaments, which is anterior inferior tibia fibular ligaments, posterior inferior tibia fibular ligaments, and interosis tibia fibular ligaments. The common injury is an inversion or dorsiflexion trauma to the syndesmosis that cause from sudden twisting, turning, or cutting motion while jumping and running. The mechanism of syndesmosis, which is the most common mechanism, where individually and particularly in combination, or external rotation and hyperdorsiflexion. Both cause widening of the mortise, resulting in disruption of the syndesmosis and talar instability. According to Kappa, the accuracy of this test, the sensitivity of 20% and specificity of 84.8%. Firstly, the patient position should be knee hanging in 90 degrees. One hand holding the leg for stability and the other hand grabs the metatarsal area and externally rotate the foot with fully dorsiflex the foot. The test result will have pain at the side medially, and it may radiate upward to the leg depending at the severity of the injury. We do remind that do not force the rotation if the test is positive, where the patient will feel the pain at the medial of the anterior leg, and do refer to the orthopedic surgeon to stabilize them.